Good evening, everyone. Welcome to tonight's Precision Orthopedics and Sports Medicine webinar on minimally invasive treatments for foot and ankle pain. We're thrilled to have you joining us. This session is presented by Dr. David Lin, a double board certified foot and ankle surgeon, and Dr. Lin specializes in ankle and foot trauma, reconstruction, and total ankle replacement. So a quick reminder that tonight's session will be recorded, and we'll be sharing the recording afterwards so you can revisit any part of the discussion or share it with others who may benefit. Before we begin, please note that the information shared in this session is for educational purposes only and does not constitute individualized medical advice. If you do have specific concerns or symptoms, Dr. Lin's here. We encourage you to schedule a personal appointment with Dr. Lin or one of our other providers to get an individualized evaluation. So throughout the webinar, feel free to submit your questions in the Q&A box. It should be a ask a question. You can select it at the bottom of the pane. And I'll be collecting questions as we go. In the last 10 minutes or so of the meeting, we'll save space to get those questions answered. And if we don't get those questions answered within tonight's meeting, I'll try my best to follow up with you afterwards to make sure that we get that addressed. So with all that said, let's get started. Dr. Lin, thank you so much for leading tonight's discussion.
Thank you, Danielle. I'm Dr. Lin. Nice to meet you. Maybe I've met some of you, maybe not. But today I've been asked to kind of present some of the stuff that I do for Precision. One of the things that is up and coming is MIS surgery, which is what we call minimal invasive surgery. And so a lot of times when we are dealing with bunions, hammer toes, even like big fusions inside the foot and ankle world, we have these big incisions in the past. And so I'm presenting something that is a little bit more novel. I've been doing it since 2019 and been getting very good results with it. And it's called minimal invasive reconstruction surgery, okay? Today, I'm just gonna be presenting more of a forefoot type thing. We won't get into the rear foot and the ankle, but I think I'll let the pictures speak for themselves. Some of the presentation slides do have images that are a little bit more gruesome. I did try to blur as much as I can out, but I just wanted to let you guys see the extent of the incision. So without further ado, I'm going to go ahead and share my screen. I think my screen's already shared, right? Is that correct?
Yep, it's shared.
Cool. All right, I'll just go play. Here we go. All right, so next slide. So talking about foot and ankle surgery, we're just gonna focus on bunion and hammer toes mainly, okay? On your right side, this is a picture of kind of a new way of doing bunion surgery where you have a 3-screw construct. You can see the screw at the very end of the screw head. It's beveled, and so it kind of ensures the screw not irritating a person after the surgery. So traditional bunions, we kind of blurred this out a little bit, but you can see incisions are huge, right? So if you look at hammer toes, you tend to have super long incisions, and this has been done very traditionally since I was in training. It's very, very common, and a lot of times when you have these big incisions, you tend to get infections more easily compared to if you have a small incision, and it's harder to take care of them. So this is for rear foot. You can see how big these incisions are in the foot and ankle, right? And then, so let's talk about minimal invasive surgery. So let's take this hammer toe for an example, okay? This hammer toe, you can see the toe is crooked. The patient, she cannot physically move that toe back in place without using her finger to do it. It's been bothering her. Now, the traditional options for these are either I fix them surgically with a big incision from the middle, or I have to amputate the toe for some older gentlemen. So those are your traditional options for these. Most people opt for fixing them, but now we have a new method to fix them. And so this is some intra-op images, which we use a rotating burr to cut the bone and realign the bone. So take a look at the incisions. You see the two arrows. You'll see one incision and incision, a small stab incision, and there's no long incision that you can see. So next slide. The magic happens with these burrs that we have. So these kind of surgeries have been around for quite a while, actually, but because we didn't have good intraop materials to fixate these, um, a lot of them don't come out with good results. But nowadays we have these specialized burrs, specialized screws, and that has really advanced MIS surgery uh, to the modern day. These are just some studies just telling you the burrs, they actually provide a lower temperature when you're cutting bone. And so what that does is it prevents thermal necrosis in the soft tissue and the bone, so the bone can heal better. So, again, more studies. So this is kind of an intra-op image. This person has a hammer toe with essentially mangled toes. We did our surgery with a burr, and you can see this is how we fixated. And these are some of the incisions that you see. So instead of a long incision, you're looking at dots. So, so this is what we call a bunion, right? So you can see on your left image, you have your first metatarsal, which is on your left screen, kind of pointing outwards, and you can see the bump. I don't know if you can see my mouse. So this will be your first metatarsal. This is your second metatarsal. You see the angle between your second and first is enlarged, and that's typically what we call a bunion deformity. I'm going to show you some of the incisions that are used traditionally. So if you look here, this long incision is typically what we see, or this one on the very right side. With minimal invasive surgery, you're only going to see dots, and I'll show you some examples of that. So these are some before and afters. You don't see a long, ugly incision, right? You only see little dots right here, dots right here, okay? This is an intra-op image of how we put in the screws. So you can see this is what we call a capital fragment. We make a osteotomy here and we shift the fragment laterally, and then we drill and put in the screws. And your incision is literally 1, 2, and 3, and that's it. You're done. I can show you a video of this. This is something that was compiled by my buddy up in Northwestern University. Can they hear audio by any chance? Here.
Most likely.
Okay. So you can see it's a 3D correction. It's not just a 2D correction. And I don't think that played. That's okay. We'll move on. So 3D correction, you see the sesma is correct, fall back under the bone. Next slide. Oh, there we go. All right. Did you guys hear the music? Or I can't tell.
I didn't hear the
Regardless,
music, but I saw all the visuals.
oh, okay, that's cool. I was trying to be fancy. Anyways, next thing is you can see these mangled toes and you can see the incisions here. We corrected the bunion and we corrected 3 hammer toes. Typically, these are what we call 4-foot slam surgeries. And I remember in residency, these can take up to 2 hours to do. Like they're quite long surgeries. We were able to finish this in an hour or less. And look at how many incisions we have, just dots. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that's it. We were done. All right. Talking about first MVJ arthritis, a lot of people need fusions for this type of surgeries. You can look at the x-ray here on the right side. There's a big bone spur on the top. And we can remove that with MIS surgery as well. This is some intra-op images. So, okay, we free up the soft tissue. And then we use the burr to burr down the joint. And then this is kind of the joint being blurred out. Again, burring the joint. And then we put cross screws across and that's the cross screws. And look at the incisions. 1, 2, 3, 4, and you're done instead of a big ugly incision. So that's it. That's pretty much my presentation. MI surgery is usually faster for skin healing. It doesn't change your bone healing rate, okay? It reduces your skin necrosis, your bone necrosis. It also cosmetically is better looking. And in certain situation, it can promote angiogenesis, which is what we call vascular improvement in your lower extremity. So that's all I have.